Well, my personal goal is to help the board understand how well we do things and help them feel good about all the neat things they're overseeing, but also let them see a couple of the key challenges that we're really wrestling with that we're beginning to come to them for discussion and eventually decisions.
An opportunity for the board members, the trustees, to understand the behind-the-scenes part of the hospital, and also to see the impact of the decisions that we make on the daily lives and the ability of the nurses and physicians to do the job they're charged with doing. We were thrilled. We thought this is something we have, really got to do. This is a great opportunity for our board. You have very few MDs or RNs or nursing. You've got bankers and farmers and salesmen and a lot of people who do a lot of things, but a clinical experience in a hospital is something all unto its own. It's a whole different world.
We started it in the spring of 2017, and we spent a little bit of time at the executive committee level trying to decide exactly how we wanted to do it, which areas, how many people could go through, and we decided that we could handle about 2 trustees at a time. So we did 3 sets of 2, so 6 trustees in total went through this first round. And we tried to set it up so that the trustees would, as much as possible, go through from a patient's flow perspective and hit the busiest parts of the day. The senior leaders of the trustees helped design what they wanted it to do, and then I called the key managers in from each of those areas: surgical services, the emergency center, the chief nurse, and a couple of the floor managers to say, how do we want to set this up? What do you want to make sure you show them? But I really did not want to coach. We didn't set up any particular questions that needed to be answered. I said, here are the things the trustees may ask you about. But the trustees that went through were all strong individuals, extroverted personalities, were willing to ask questions, and I trusted both the trustees and the staff on the floors and in the different departments to have a healthy, genuine dialogue. I think some of the managers were initially a little nervous about that, but the managers we have in place, in particular the areas they visited, the ICU, the new chief nurse, our surgical services director, our emergency center director, they are really strong leaders. So when they got plugged in and said, I'm going to make sure they know my department shines, they pulled out all the stops. As I said, I completely trust you. You guys decide what do you want to show, how you want to show. The trustees are going to ask you questions, but they're committed folks. They're not going to try and press you. They're not going to try to embarrass you. But you just show whatever you want to show. You bring your staff in. You let your staff talk to them. And I think both the staff and the trustees found that engagement was very genuine, very sincere, and everybody benefited a lot from it. The other big issue we were still wrestling with at the time is a new information systems platform. So to have the trustees spend time with the nurses and the hospitalists on the floor, as well as the emergency center physicians, say, here's what our system looks like now, and when it's not as integrated as we would like it to be, here are some of the safety and patient care concerns that happen when we don't have a unified record. So when we start bringing them a new platform with an extraordinarily expensive price tag to it, they could have a better feel for, we understand why you need a new system.
And you sit in meetings and you read the white papers, and there's always something maybe missing, you think. And then you go through this immersion and you see the interdisciplinary rounds and you see the safety call, and then it clicks.
And we had a conversation just the other day at our executive committee related to emergency center and behavioral health patients, and they were able to say, I saw that area. I can see why we struggle with that particular issue.
And it's also incredible the number of people involved in the care decisions of any patient. Like in the interdisciplinary rounds, we went into a room full of people. Social workers, occupational health, physical therapy, respiratory therapy, pharmacy. Everybody was in there, and each inpatient was discussed in depth and what do they need to be discharged, what do they need to improve to this level to move them to a different level of care. And it was phenomenal. I think maybe that was a surprise too, is how many people it takes to get you out of the hospital once you get in. We did not sit in on a telepsych call, but hearing from the nurses and the MD about how valuable that is. We didn't see a telestroke patient, but we went in the bay where the telestroke unit is set up, and how valuable that is. And those are all big things, new, innovative things in patient care that you hear about them, but until you see them in effect, you don't realize the impact.
We learned that it was a very busy day and a very hard day for them. We learned after the first meeting, actually, we need to make sure they had time to sit down because we had them standing all day long.
It's very enlightening, and it does give you a real, not only understanding, but it makes your pride, it deepens your pride in what you're doing, and confidence in what everyone's doing.
We had the two trustees that rotated through share their experiences, and one of the things that really came out of both sides that we hoped would happen, but we didn't know that it would happen to this degree, was the amount of passion and pride and ownership the trustees heard from the staff. They were really proud to show off, but then for me, similarly, to listen to the passion and the pride and ownership that trustees had when they sat in front of their peers and said, you guys got to do this. You need to be proud of what's going on in this hospital system. And you also need to understand some of the challenges the frontline staff have when they're struggling with space issues or IT issues or not enough staff issues. I think we'd like to do it annually, and what we need to think about at the board level is the potential advantage of bringing other stakeholders in. Do we bring in the media? Do we bring in our legislators? Do we bring in foundation trustees who express an awful lot of interest and understanding because they're out there from a philanthropic standpoint? I'm going to have some of the feedback from some of our trustees. Do we do an entire day in a particular area? Do we spend an entire day in the emergency center? Do we spend an entire day in surgical services? Or alternately, do we break it up in a couple of half days? Because for a lot of our trustees, they're working, they can't take a whole day off. So we had a couple trustees say, I can't give you a day, but if you could set me up for half a day, for half of the program, this Friday, and the other half, a couple of Fridays out, maybe we could do that.
It's so enlightening and eye-opening in the importance of everything that we do as trustees.